Okay, welcome back to Sketches in Surgery. I am Earl Stephenson Jr., your board certified Atlanta plastic surgeon, and we're going to talk about neck lift, and we're dividing this series into three parts. We're going to talk about the parts of the neck, and they will correspond with each video. This is the first video called the superficial neck, or the shallow neck, whatever you would like to say, but this is the layer just beneath the skin. The skin is a bit of a given, so I'm not going to create a video about that. But we want to talk about the layers, the superficial neck, which I believe includes the fat, the middle neck, which includes the platysma muscle, and then the deep neck, which includes the digastric muscles, the hyoid bone, and the submandibular gland. So, in this video, we're going to talk about the superficial neck, and the superficial neck contains and it's composed of fat. So, there is subcutaneous fat. That means fat beneath the skin. Cutaneous meaning skin. So, it's fat beneath the skin, and it's illustrated by these round orange circles on a side view, and then here on a underneath view. And this, I also drew the platysma muscle, which is part of the middle layer, but it's relevant as to context and anatomy. So as we stay here on the underside view of the neck, you can see these circles that are orange, and they represent fat. And a lot of people who see people who have necks that are not sharp will consider that they have tons of fat. And fat is a component of this issue, but it is not the only component, as I mentioned earlier, but we're going to focus on fat. So with that being said, this fat needs and often needs to be removed. And these would represent the fat cells underneath, just beneath the skin, and these smaller ones would represent the fat cell between this broad muscle that's divided, called the platysma muscle. And on the side view, this would represent the fat that's just beneath the skin, and then the fat between the muscles would be here. So what do we do? How do we treat that as board certified plastic surgeons? So first, obviously, we're going to make an incision just beneath the chin and the crease. We're going to get underneath the skin, and we're going to expose this fat. And then we may remove this fat. It may be liposuction just in this area, just to kind of thin down the fat. And if we were to do that, and I'll use this as my liposuction cannula or instrument, we would just smooth and remove this fat. So we empty out this space a bit. Now, we don't take it all the way down to the skin because we can't do that. That would create really crepey skin that looks like a skeleton or a cadaver, which is probably a better term, which is actually a dead person. So we don't want to do that. So we want to keep a little layer of fat to kind of create a bit of smoothness and youthfulness. So we would do that. So these larger cells, and I'm going to erase a little bit of our platysma when I do that, but you get the point. We take these fat cells out to kind of smooth and kind of empty that area, but keeping just a little layer just beneath the skin just for smoothness. Now, this layer of fat in between the platysma muscles, that's a little bit of a catch-22. Some docs, including myself, will empty the space just a bit. Not a lot, so maybe just a little bit. Just a little bit. But what we don't want to do, and what should not be done, in my opinion, in the opinion of some of my colleagues, is that we completely empty this space. We don't want to do that, and that doesn't make sense probably to people, because people say, well, I want this to be as contoured as possible and not full and fluffy. If you do that, you can create what we call a cobra deformity. And you've seen a cobra or a snake. They have this neck that looks kind of ridged, and we don't want to do that. Well, when we take out this fat here, we create harsh lines of this muscle. Now, typically in neck lift surgery, we don't leave these muscles completely separated. What we do is re-stitch them together. And you can look at my second video that pertains directly to that. But despite doing that, that still creates an empty space behind this muscle and behind these stitches. And so that you end up, and let's see if I can draw this, you end up with a neck that looks like, get my trusty eraser here, let's erase that, which is just a Q-tip. So we'll do that, which ends up with something like that. Just kind of these really stark bands. It's kind of this indentation, this weird looking kind of angle, and you end up with a cobra neck, and nobody wants that. So we want to create, when it's all said and done, when we've kind of worked with all of these structures, whether it's superficial, middle, and or deep, we want to create a contour that is nice and smooth. We want to create that, and we want to leave some of the fat. We want to leave fat just beneath the skin so that it has a smooth outer contour. We want to leave a little fat here as a buffer, but we want to take out kind of the fluffy middle. And so with that being said, over treatment of the neck can be a problem with a novice surgeon. A well-skilled, experienced plastic surgeon will appreciate not trying to over-contour this component of the neck and really have a lot of respect for appropriate removal of fat. So the moral of this particular video is we want to address the fat if the fat is an issue, but we don't want to completely or overdo it. We want to leave some fat behind. When I was training, whether we were doing liposuction here, on the tummy, on the arms, or outer thighs, we were always taught it's not what you take off, it's what you leave behind, because this is the contour that's going to represent your treatment, not what's in the bucket per se. So with that being said, most important component of the superficial layer is, in my opinion, the fat. It needs to be respected. It needs to be treated if it's contributing to the abnormal contour of the neck. And seeing a board certified plastic surgeon doesn't guarantee that, but it certainly increases the chances that that surgeon appreciates that because of our training. With that being said, if you're interested in a neck lift or facelift or any other plastic surgery procedures such as breast or body, then I would love to work with you. It just requires a simple call, schedule a consultation. Our office number is 770-466-4700. Would love to schedule a consultation, whether it's in office or virtual, with you. Sit down with you at least an hour and go over your desires, your wishes, come up with a plan that works for you, and then arm you with that information, and you can make the best decision possible for you. Our consultation fee is $225, but we try to add value to that by spending at least 60 minutes with you, answering all your questions. This is not a rushed situation. My office is not jam-packed with clients, and we're not double booking ourselves. We treat each client as the only client, because that is how we are set up. When you come in for your consultation, 9 times out of 10, you're the only person in the office at that moment in time for that hour and a half, because we don't want our attentions divided. So again, 770-466-4700. If you want to work with me, if you're not quite sure, you want to check me out, I have a website, www.esjaesthetics.com, or you can like and subscribe to my YouTube channel and watch more videos from Sketches and Surgery, or tune into my podcast episodes, Plastic Surgery T&A, that's Talking Advice. That's every Saturday around 11 o'clock. So again, like and subscribe, and if you do, hit the bell icon so that when you do subscribe and you want to be notified of new videos, once you hit that bell icon, you will be notified. On that note, thanks for watching. and we'll see you next time.